What would you do if you were at home and tragedy struck? Do you have the tools that it takes to keep your loved ones safe until EMS arrives? Well, I'm going to walk you through everything that I have in my personal trauma bag or my first aid kit that helps me keep my family safe at home so you're better prepared. The main goal of treating injuries in the field or at home is to keep them stable or save time until EMS arrives so they can get them to the hospital for definitive care. One of the major causes of death in trauma patients is significant bleeding or extravasation. So, the mainstay of every home trauma bag or first aid kit should be centered around controlling bleeding. The number one cause of death in trauma patients is traumatic brain injuries, but in the field or at home, there's not much you can do to help with that. And the second most common cause is then significant bleeding, and we can at least try to control that. But I'm going to start with the basics first. In the emergency department, how we treat trauma patients is in a systematic way, starting with the ABCs. Essentially, that stands for airway, breathing, circulation, then D for disability, and E for exposure. So, the first set of items I have in my bag are just some minor items to help with the airway. So, the only thing that I actually have in my trauma bag for airway are nasopharyngeal airways. So, essentially, insert this into the nose, it helps keep the airway open. This is really good for patients who are obtunded, maybe patients who have seizures in their postictal and a little confused. Some other things that I would recommend for a home trauma bag or first aid kit that I necessarily don't have is a BVM or a bag valve mask, or even one of the face masks for CPR. I think in the future I probably will get a BVM just to have in there. They're a little bulkier, and I haven't found one that I exactly like at this time. But right now, I just have the nasopharyngeal airway with some lubricating jelly. Like I said, very important to help keep the airway open if somebody is obtunded or unresponsive. The second step in trauma care is the B's or breathing. And I do have various tools that you can use in the field to help with breathing. Most often than not, if somebody has a traumatic injury in the field and they're having difficulty breathing, the one thing that we could help prevent is a tension pneumothorax or a collapsed lung that essentially pushes the center components of the body away, which reduces blood flow back to the heart, which then causes the body to not be able to perfuse appropriately. So first, I have these essentially needles. They're decompressive needles. They're for tension pneumothoraxes or pneumothoraces. If you don't have training in these, I probably wouldn't use them. But paramedics, I know they know how to use them. I would recommend having this in their bag. They probably already do. Medics from the military know how to do this. Highly recommend having these because even just blunt trauma to the chest can cause a pneumothorax, and a tension pneumothorax with the air released is a good way to keep them alive until the EMS gets there. Next, I have is essentially chest seals. I have the hyphen vent compact. Essentially, this is for penetrating chest wounds or gunshot wounds, or more often than not, gunshot wounds to the chest. This helps prevent a sucking chest wound, or essentially helps prevent more air getting in there and worsening of the pneumothorax. Highly recommend having at least a couple of these. While this is more rare at home, you never know if you keep this in your car what might happen or what you might see. So that's all I really have for breathing. Again, I just have the decompressive needles for tension pneumothorax and then chest seals for penetrating chest wounds. I hope to never use these at home. I do keep my trauma bag in the car sometimes, so that's why I have them in there. Um, so the third thing, and I think the most important aspect of trauma care pre-hospital setting at home, if one of your loved ones got injured, would be controlling the bleeding. This is something that we have ability to do. Ability. There's tools that can help with this. It doesn't take very much training at all to prevent worsening of the bleeding at home. So that's the C in the ABCs. That stands for circulation or bleeding. All right, first up, I have Rhino Rescue trauma bandages. So essentially, this is a compressive bandage. It helps apply pressure to the wound. So if somebody has a large laceration that's bleeding profusely, you wrap this around it. It has a pressure kind of wrap to it, and it helps control the bleeding in that way. If somebody has a worsening wound or a really significant open wound, I also have compressed gauze. Essentially, this allows you to, pack the wound, and then you could then put a compressive bandage around the wound once you pack it. This just helps keep that area filled and helps absorb some of the blood and apply pressure within the wound. I should have probably went over these first, but these are one of the mainstays of treatment of significant bleeding in trauma patients, pre-hospital. It's a tourniquet used for large lacerations to the limbs. You can't control the bleeding or even an amputation to the limb. God forbid. I don't know why that would be happening at home. But if you're again, if you're in your car and you see a car accident, something terrible, if you don't know how to use one of these, they're very simple. You can watch a video online. Essentially, you put this 2 to 3 centimeters above the wound, you wrap it really tight, and it essentially cuts off the blood flow prior to getting to the wound. Um, you really don't want to keep these on longer than 2 hours because the tissue beyond that point will start to die from lack of blood flow. But hopefully, they're at a hospital at that point. If they're not at a hospital in 2 hours, there's something really terrible going on. But very important. Another good tool is this quick clot or trauma pack. This was developed by, I believe, the military, and it's carried in their IFACs. Essentially, what you do is this has a bandage in it that has a material on it that causes the blood to quickly clot. You would put that on the wound, you would wrap the wound, and it would cause the blood to coagulate or clot in that area. Um, this is something good to have. If everything else fails, you could throw this on it. It should stop the bleeding pretty well. They're really cheap online. I think this is maybe $30 to have. You just throw it in your bag. And then that's the mainstay of my trauma kit. As you can see, it's really not a lot. I do have a significant amount of gauze and tape in there as well, just to help with further bleeding control and circulation. Because again, that's the mainstay of treatment and the number two cause, but at least the number one preventable cause of death in trauma patients prior to getting to the hospital is bleeding or even the hospital. I do have some other random things in my personal kit that I would recommend. I do have a way to take basic vitals. I have a manual blood pressure cuff, and then I have a pulse ox. So you give some basic vitals. I do keep my stethoscope in here. I just change it in and out of bags for work, and then keep it in here when I'm not at work. But it's in my work bag at the moment. Um, I have an emergency thermal blanket, or I'm sorry, blanket, more so for we live in a very storm heavy area, so this is more so if a terrible storm were to hit in my family. So we keep that in there in our storm shelter, um, among other things. I have one last thing here. Lastly, I have this Rhino Rescue moldable splint. So if somebody, usually a kid, falls, a kid or elder, I guess we'll say, falls, breaks their arm, and you can see an obvious deformity and it's clear that it's probably broken, you can you can put this on as a splint, and it will help with some of the pain relief because it should immobilize that injury. And it's good to keep it on them until EMS gets there, or even until they get to the hospital. Again, really cheap, easy to throw in there. One last thing I have in my bag, and this is a basic home first aid kit. This alone is not enough for home. This isn't enough to keep your family safe, but it is a good adjunct to your home medical kit, because in here you have all your basic first aid stuff. You have some medications, you have your antiseptic wipes, you have Tylenol, ibuprofen. You have aspirin in here. I would also recommend putting in here stuff for allergic reactions. So Benadryl and Pepsid would be really good to have in here as well, just in case, even if your family doesn't have allergies, if one of their friends does. I have some tweezers in here. I have some syringes. I have some steri strips, just some basic stuff. So this first aid kit, again, is not enough alone, but it is good to have in conjunction with your home trauma kit. If there's anything that you guys keep in your kit that maybe I didn't even think about, and you recommend me having it, or you recommend everyone else having it, just drop a comment below. I'll probably run out and get it. To be honest, this is pretty new since we got settled in our new area. This is still a new kit to me, so I'm kind of working on what I want in there. I don't want it overwhelming, but I want to have the really important stuff that I need to keep my family safe and even my neighbors if anything terrible happened. So if you want to see more medical content, emergency medicine specifically, home care, kids, things like that, just like and follow. I really appreciate it. And until next time.